Hello, this is Dr. Hema Divakar, a senior obstetrician and gynecologist from the DIVAKARS Speciality Hospital, J.P. Nagar, Bengaluru. Well, when you visit a mall, you will look for a standard size of the dress which fits you small, medium, and large. Similarly, no two babies are expected to be of a same or a constant weight. The range of the weight will vary from 2.5 kilos to 3 kilos to 3.5 kilos in keeping with small, medium, and large. And why does this differ? Small, if the parents are small made, genetically small, somebody in Punjab cannot be similar to somebody born out of South Indian parents, for example. So these are the normal variations. But instead of saying what is the one weight which is normal, keep in your mind a range of weights. But if a small sized baby is growing along one part of the graph, it will keep to the same, and that's normal for that baby. That's what you should remember, and not compare your baby weight to your neighbor's baby weight, etc. And the small does not mean it's a sick baby, it is meant to be of that size. So 2.5, 3, and 3.5 are broadly the figures that you should remember. Sometimes when you get the scan done, the doctor will say, maybe this baby could have grown a little bigger. It looks a little small. And that will get you starting the point of anxiety and worry. What the doctor means is that potentially your baby could have grown to a 3 kilo baby, but something is making it of a lesser weight, 2.5, 2.2, or even 2 kilos. When does this happen? This happens when somebody who is not getting enough nourishment and starving in a weight loss program, for example, they will lose weight. Similarly, the baby is completely dependent on the mother for its nutrition. So, if the transfer of nutrition through the blood supply from the mother to the baby across a plate of blood vessels, which is called the placenta, if there are clots in the placental blood vessels, for example, or if the mother is having a high blood pressure and against that pressure, enough blood cannot move from the mother to the baby. These are few of the reasons why the supply from the mother to the baby becomes less. So the potential weight that the baby can gain is lost, and so it becomes a small baby. In these circumstances, it's very, very important to discuss with your doctor how you can improve the blood supply. Of course, there are some medicines, but the primary problem of blood pressure in pregnancy, for example, that needs to be under control. There may be more number of scans that you may be exposed to, because we have to keep track of how small the baby is, having said that it is smaller than usual, and also there is rich food with proteins or protein powder supplementation. So whatever little blood goes into the baby, it goes with the rich content of nutrition, especially the proteins. With all these aspects taken care of, and also the fact that your baby, though it is small, is being monitored so that the small baby does not become sick. The sickness and the well-being are the most important factors. The size here really, really does not matter. So put your anxiety aside, be restful in your mind, and follow the doctor's instructions. And you will help your baby grow to the maximal potential. Well, indirectly, we always say that the weight gain in the pregnant mother, month after month, except the first 3 months where you may be having a lot of vomiting, you can't eat well. So, we really don't expect much weight gain in the first 3 months. But subsequently, the next 3 months and the last 3 months, you should be gaining weight at least about 8 to 10 kilos in a normal pregnancy. We sometimes restrict the weight gain in pregnancy with diabetes, for example, only 6 to 8 kilos of weight gain is allowed. So, weight gain of the mother is an indirect indication of how well the baby is growing and how large the baby could be. A large baby does not mean it's not a sick baby. Big is not always better. I mean to say that if the sugars are normal, then a large baby of 3.5, if it is genetically made that way, you will have a baby size of 3.5. But if you have high sugars, like in gestational diabetes, then the baby is growing larger than expected. That is also not really good. So, how to make the baby size bigger should not be the question. Is this baby, which is meant to grow as a baby of 3.5 kilos, that is the larger sized baby in the comparison which I have already explained to you, is it growing adequately on that track is what we monitor. So, just by comparing notes, again, I bring back to the point, each individual is different, each baby is made differently. What is good and what is normal for your baby is not necessarily the same for the other babies that you're trying to compare with. Even in the office, if somebody looks at your tummy and says, oh, this looks too large or this looks too small, don't be carried away with that. If you are anxious about it, please check with your doctor. She will explain to you whether this baby really needs to enhance its size and become a large baby, or is it growing fairly satisfactorily so you don't have to really worry and do anything about it. So each individual pregnant woman and her baby is very special, and what it is meant to be, if it is going along that track, don't worry too much about small, medium, big, etc. You must aim to have a healthy baby born on time.